Hi, I'm Wendy, and I am a dental hygienist serving the senior community in Georgia. I go to assisted living and memory care and provide on site dental cleanings. Right now, with the way that the laws are in Georgia, I cannot take x-rays for my patients on site under general supervision. I'm going to give you just two situations that I've had recently where the patient really needed x-rays. One of which was an individual. He had a very complex medical history and was bedridden. He would require medical transport to go to a dental office, and he would have to stay on a stretcher whenever he went for the appointment. His family reached out to all of the dentists that they could in their area, and none were able to accommodate the stretcher coming into the dental practice. That's when they reached out to me to try to at least get a dental provider to come take a look and try to help coordinate care for his needs. With the way that the law is written, I am not able to provide a cleaning for him, but I was able to come do a soft debridement and help remove plaque and take a look at the tissues and see what was going on in his mouth. And then I could help coordinate and explain what possible needs he had. Just with the intraoral assessment and looking around, I could see that there was a tooth that was broken off, and that was probably the cause of his pain. And so I coordinated with the dentist that supervises me, and we talked about how we could accommodate the stretcher in the dental practice. But it was a little bit more of a drive, and so the transport would be very expensive to bring him to us to provide these services. And we weren't 100% sure as to what services needed to be provided because we didn't have an x-ray of the tooth. We also knew that oral surgery could be a part of the treatment plan. And this is another situation where the x-ray would have been helpful in exploring which treatment options would be best for him. And so this is just one case scenario of number one. I really wish we could have provided more than just plaque removal for him there in his home. And secondly, just really needing an x-ray to coordinate this care. It was going to be very expensive to have a medical transport, bring him to the office, wait for a possible dental surgery or root canal, and then transport him back home. So x-rays would have been very helpful for this patient. So hopefully with changes in legislation, we can make this, a better situation for patients like this. Another case scenario was I had a lady with advancing Alzheimer's, and she was in a community home, and so we were able to provide her cleanings on site, which was wonderful, and we really developed a rapport, and she got used to me being her dental hygienist and her care provider for her mouth. We knew that we wanted to get x-rays, and she was actually in a home that was very conveniently located to one of our practices. It just was very difficult to have her moved due to her memory state, and then also just her mobility, being in a wheelchair. It did take 2 attempts to have her family coordinate schedules to be able to bring her to the dental practice for her x-rays. Once she was there, I wasn't there to assist with getting the x-rays, and she actually had a really hard time. She kept asking for me by name, and wanting to know where I was at to be the one taking care of her mouth. And out of the x-rays that they were able to take, with her being resistant, being in an unfamiliar environment, only one was a diagnostic image. And her family decided that they didn't want to push the visit any further, so they went ahead and called it a day. An advantage to where if I could provide the x-rays on site, if we tried and we only got one diagnostic image, it wouldn't be as much of an inconvenience for her family and as much added stress on her to be able to try again another day. When I would be at the home again, at the senior home again, I could just try on another day and maybe get one more diagnostic image and one more diagnostic image, and then we would have enough to really see everything that was going on for her and check on all of her restorations and see what we can't see with the naked eye. And so that's just another situation that came up pretty recently this year, where on-site radiographs from a dental hygienist would have provided a higher level of care and met her needs better. I hope these helped you get a glimpse into what it's like to care for our aging community and meeting their needs and ways that we can change legislation to improve these services that are being brought to them. Thank you so much. My name is Wendy, and feel free to reach out with any questions or if you need any clarification on ways that you can help.